I am Dr. Muzaffar Shah-Khan, and this is Perspective with Dr. Shah-Khan. Before we get started, make sure to subscribe, like, and comment. Hit the bell notification button to be alerted of any of my new videos. Why wouldn't you? It's free 99, so it's completely free. Go ahead and do that for me. I would appreciate it. Share it with your family, friends, your haters even. I have plenty of them, so I know how that goes. And it's just kind of part of the territory, right? That's kind of what it comes with. So yeah, I would definitely appreciate that. This is a very highly requested video from friends, family, some Instagram followers as well. And I think it's really important that, I do kind of share what I feel kind of and what's going on, and I just want to give some of my recommendations as well because I think it could really help a lot of people. All information that's going to be presented in this video are from credible sources and verified sources such as the Centers for Disease Control, the CDC, the American Dental Association, the ADA, as I am a dentist and surgeon myself, the World Health Organization, coronavirus.gov, my personal education and clinical knowledge, and my colleagues of several different medical and dental specialties. So, the info that you're going to be getting, it's going to be totally legit, and, so that's not something that you have to worry about. I will link everything in the description below, so if you're just like, I don't know about this dude, like, he's cool and all, but, so you can look up everything yourself, like, that's totally fine. The problem with the internet and social media is that there's a lot of just unqualified people, a lot of unqualified and just dumb people, just like plain dumb, that like to talk about things that they have no idea about. And the thing is, a lot of those people have large followings for whatever reason that may be, and that's fine. But I, Dr. Muzaffar Shah-Khan, will try to help in whatever way and whatever capacity that I. So things are constantly changing with this virus. So I think it's very important that I let you know today's date. It is currently Sunday, March 28th, 2020. It's the evening here. I'm actually shooting a few videos, so just kind of gotta plow through it. So because the thing is, like, everything is like changing so fast, so you just really need to know that today's date and everything that I'm going to be presenting is that's the most current information up until today. As of 4 p.m. Central Standard Time today, globally there are 713,171 cases of coronavirus, and in the U.S. there's 135,029. Reported global deaths are 33,597, and in the U.S. 2,370. The virus is affecting all people of all ages from 0 to 100. Yesterday, actually, an infant in Illinois died of the coronavirus. In Italy, 51 doctors have passed away due to the coronavirus, and in New York, there is currently, I believe there's 3 doctors that have died. More than 700 members of the NYPD have tested positive for COVID-19. 3 have died, in addition to the fire department as well, which I know that a lot of them are testing positive, and thoughts and my prayers are with them and all of their family members. I personally feel that there are a lot of unreported cases due to just lack of resources and just plain human error. I think certain countries want to report a lesser number of cases and certainly a lesser number of deaths so that they can encourage everyone to go back to work and kind of just keep supplying the world with stuff, right? And just keep getting that dough. But whatever. I'm not going to spend much time discussing the background of the coronavirus because, it's here, it's rampant, and who cares really, honestly. Well, I mean, not who cares, but it's we need to be proactive. We're a little beyond that stage. The coronavirus isn't new, but this strand that we're dealing with is, right? So COVID-19, CO stands for corona, VI stands for virus, the D stands for disease, and 19 is for 2019. So, and which is, that's when this strain started. The isolated strand, which we know originated in Wuhan, China, likely from bats. The reason how this came to humans is a interaction between bats and humans, however that may have been. Doctors that I know personally have even contracted the virus. This is something personally that I just have not experienced before. But you know, it's important to understand, right? Like what to do, and to, of course, be very vigilant. Because that's really all that we can do since we're literally in the midst of an epidemic. By vigilant, I mean aware. I don't mean purchasing as much toilet paper and sanitizer as possible. And there's like literally like grown women like fighting over supplies and like jumping one another. You know, it's just very unnecessary, and it's just really trashy, to be honest. So like, stop. Prevention is very important, okay? And there is a lot of confusion about it. So this is a respiratory illness, right? Coronavirus is a respiratory illness, meaning through your lungs and breath. So if someone has the coronavirus, right, and they breathe on you, then you can get it. Okay, if someone has it, if someone has COVID-19, right, and they touch a surface like a door handle, for example, okay, and then you touch that door handle, and then you proceed to touch your face or to rub your eyes, or you eat something without washing your hands, that is how you can contract it. So the best thing that you can do to protect yourself is to wash your hands. I cannot stress that enough. If you don't get anything from this video, like, except for that, just take that, is that just wash your hands. Because if you don't, you're nasty, okay? Like, wash your hands, especially now. Toilet paper is a must, obviously, when you go to the bathroom, but soap and hand sanitizer is certainly most important. A lot of people do not wash their hands much, even after using the restroom. This goes for both men and women. Like I said, don't be nasty, okay? Especially now, wash your hands, because it's really, really important. I personally wash my hands very thoroughly. So the guidelines are to basically like sing the happy birthday song to yourself like twice, or the ABC song like twice. And then it's important to get all surfaces of your hands, you know, like this, but also like the back sides in between like all the crevices and your thumbs, right? And like you should like be scraping everything. If you want me to film a hand wash tutorial, I can do that. Just let me know like in the comments, okay? This kind of like the news kind of broke, at least like in the US, it was kind of more like in January. I've just kind of like tried to step up like a lot of things myself, right? Personally, hygienically, in my office, in my practice and everything. So after I wash my hands thoroughly, I also spray hand sanitizer or just plain rubbing alcohol on my hands. And I'll show you, I have like a bunch of stuff here to show you guys as well, regarding like prevention. And it's okay if you have dishpan hands, you know, you can moisturize some other time, like, you know, it's like not that serious, okay? Social distancing, right? That's a huge thing. So, which means stay at least 6 feet away from people, okay? That is a recommended guideline of the distance that you should be away from others. So, you know, me personally, I did go to one of my friends' houses a couple weeks ago. Shout out to Dr. Akbar Saeed of Ace Dental Center. You know, that's my homie, that's my ace. You know, he's a very successful implant surgeon here in Chicagoland. But ever since then, I haven't really like hung out with anyone or like gone anywhere. I haven't seen my nieces or nephews in weeks. I'm very, very close to them. So, you know, it's rough. And like last week, so me and my cousin, we went on a hike, but like when he came, we just like kind of stayed away from each other. We didn't like shake hands or hug or anything, which is like kind of weird because like, you know, we're like boys, you know. Be safe right now. So everyone is kind of just taking the necessary precautions that they need to. Make sure you're wiping all surfaces down in your home and in your place of business. So as a dentist and surgeon, my colleagues and I are at the highest possible risk because we actually work in the mouth and we do for long periods of time, right? So since this is a respiratory issue, right, like the droplets, right, they can kind of we can get exposed to it a lot faster than like other people. These cells, they actually live in the throat and in the larynx. Majority of my new practice is oral surgery. So for example, if a wisdom tooth is difficult to remove, as like a lot of them are, I spend close to that patient. Like that's what's gonna put someone like me at. That's why those of us in the dental profession have to be beyond careful. Most have temporarily closed their practices due to the epidemic and executive orders, certainly, or are seeing patients on a very limited basis. Best thing to wipe your surfaces down is with something with more than 70% alcohol, bleach, or cavicide. So I have a couple examples, just plain old bleach, so you can use this. Cavicide, I don't have that at home because I do have that at the office. It's probably like the best disinfectant possible, so you can use that. Alcohol, rubbing alcohol, I just put it in a spray bottle. So what I like to do is I don't buy wipes, right? Like any of those Cavi wipes or the Clorox wipes even. What I do is I make my own, right? Because it's a lot more cost effective. So you just take paper towel here, you put your alcohol or whatever solution in a bottle. So you can either, do alcohol or bleach or Cavi. And then if you want to make it last even longer, you can add a little bit of distilled water. So 70% alcohol and then 30% like distilled water. Make sure you use distilled water though, because tap water has like other stuff in it. So you can do that. That's what I do. Spray all your surfaces. And this is all surfaces, right? So phones, computers, counters, door handles, faucets, fridge handles, basically anything that people kind of touch frequently. Oh, and this is what I use on my hands also. So I just after I wash my hands, I just spray. I mean, I never used to do that, but now obviously you got to do what you got to do, So this is just one I got for one trip I was on. I like the spray ones. I don't know, I just got this from some company. So yeah, after I wash, then I just spray. And then it's if you're fancy, right, and you have marble, quartz, and granite, I do as well, but you have to clean it properly, right? So vinegar and water, it ain't gonna cut it right now. So you gotta use these kind of things to just protect yourself and your family. Next thing we're gonna get into are gloves, okay? So these gloves, nitrile medical gloves. I mean, you can use any kind of disposable gloves. So when going to the grocery store, Costco, I mean, any place where people frequent and are touching things, it would be really beneficial to wear gloves. I'm talking a lot, so I need to... Especially older people with chronic conditions. A chronic condition example is diabetes, cancer, heart disease, and of course, any respiratory or lung issues. So they need to be most careful because they have the largest predisposition, or which that kind of means they're the most at risk, basically, of contracting this very horrific virus. So I have two elderly parents that I live with, so this is very personal to me. My father is a businessman. He has to meet different people for work all the time. So for example, someone like him, they certainly need to take it very seriously, and I get on him all the time about it. But now we're getting news that the virus is affecting people of all ages. Like I mentioned, a little baby died just yesterday in Illinois, and the coronavirus, it's not prejudiced or discriminatory at all.